Good afternoon, everyone. Welcome to this medical accredited program focusing on HPV and its related diseases in an online platform. Today's session is about human papillomaviruses and cervical precancer and cancer, and we're focusing on prevention and treatment.
HPV is a very successful virus, and we talk about HPV, but this is divided into different genotypes. We mainly discuss the alpha genus, which has then subspecies, and in these subspecies, as you can see, there are some high-risk species, as I put in the table, which have all an attributable fraction to cervical cancer, but that will come back later on. So not all HPV types are as dangerous.
We already know that around 80% of the population will be infected by HPV during their time life. But here you can see that the prevalence is around 10% for women aged for less than 25 and is reducing during time life. And then there is an increased prevalence at the age around 60, which is around 10% as well.
Good afternoon, everyone, and a warm welcome to all our healthcare colleagues across Belgium. Today we're turning the spotlight on a topic that deserves more attention. While rare, these malignancies are serious, and as we'll hear today, they require greater awareness, more consistent prevention strategies, and also better approaches to early detection and management.
There are several risk factors that are associated with vulvovaginal malignancies, like, for example, the co-infections, the low socioeconomic status, bacterial vaginosis, early age at sexual debut, multiple sex partners, and an older age.
How can we make sure that these people who are at risk are protected from developing an anal cancer?
Yeah, so that's the IANS guidelines. So IANS is the International Anal Neoplasia Society, and they came up with some guidelines in 2024. And if you see the risk category number 1, A, that's what I've been talking about all the time, the persons with HIV, dysplasia, MSM, and the solid organ transplant, and they have a cancer incidence of more than 17 per 100,000.
If we then take a look at burden in Belgium, we go to the bottom of this beautiful triangle, and we see that almost 9,500 women and 8,600 men are yearly diagnosed with genital warts. There was a study performed that collected data from 2015 to 2020, and that showed an overall incidence of 17 on 100,000 patients per year.
And I think it's time for discussion and for question and answer.